Hello, my name is Lisa Norton. I'm a nurse practitioner student at Auburn University, and this is my head-to-toe assessment video. My subject today is my husband. He is about 240 pounds. He's about 5'10". His BMI calculates about 34. His vital signs and all are good at the moment. We have both washed and cleaned our hands. When he walked in, he was upright and vertical. He had no gait anomalies to speak of, and we're going to get started starting with the top of the head. So we're going to inspect the scalp for any bumps, bruises, lesions, the condition of the hair, how much hair he has, and all that is normal. Moving down the back of his neck, we're going to come around and check your T and J joint. Open your mouth and close, and that is fine. And we're going to palpate the facial area for any bruises or bumps that may pop up, and the sinuses, the frontal and the maxillary are fine. Okay, moving on, we're going to look at his nose. Now his head can't go all the way back because he's had neck surgery, so hold on, let me get this up. So I'm going to kind of scoot down. So we're looking up the nose for patency. It all looks good. Septum is midline. Close one there. Breathe. Close the other one. And all that's good. Okay. And we're going to look in the mouth area. Just observing the mouth, the nose, and that whole area. All the mucous membranes are pink and moist. Nothing's dried out. No ulcers, no scabs, nothing to speak of. As we open in, we look and see he's not missing any teeth. He does have some fillings, but no anomalies to speak of. Stick your tongue out just a little bit, and I can see the uvula. It is midline, and the mucous membrane in the back of the throat is moist and pink. I do see some tonsils back there. All right, very good. Moving on to the ear. For purposes of this video, we're only going to check one eye, one ear, so forth and so on. So just palpating the ear, inspecting the ear. The skin is not dry. There's no abrasions, no cuts, bruises, or anything. His ear is perfectly normal. So we're going to have a look inside. And the tympanic membrane is pearly gray. I do see the eardrum. The cone of light is visible. There's no obstruction. Everything looks patent and good. I did see part of the malleus, and that's just the one side we're going to do. All right, we're going to move on to the eyes. And just observing his eyes, they're both equal, symmetric. His eyes are a little red. He's a paramedic and he's been up a while, so his sclera is not quite as wide as you would want it to be. His pupils are 3 millimeters, and that's normal. He does have eyelashes and eyebrows of normal, that are normal. He blinks not too much, so that indicates that his eyes are not too dry, even though he may be tired. So we're going to look just one eye. Okay. And I see the optic disc, vessels. I think there's some vessels. Yes. Red light reflex. The vessels are no narrowing of the vessels, and yeah, the optic disc is visible. So, moving on, we're going to check cranial nerves, starting with number 1. Close your eyes. So number 1 is smell. I'm gonna hold this up to your nose and you tell me what you smell.
Alcohol wipe.
Alcohol wipe. That's good. That's good. All right. Cranial nerve number 2 is sight, is vision. My Snellen chart did not come in like I ordered, so I have an app on my phone. This is by Snellen, and it advises to hold 4 feet away from the patient. So we're going to kind of 4 feet away. Cover one eye and tell me what you see.
PECFD.
All right. Cover the other eye.
PECFD.
Okay. So my patient is 20/40 bilaterally. All right. Cranial nerve 3, 4 have to do with ocular motion. So, yeah, we're gonna follow this light, and we'll see how your eyes move. Cover one eye. Okay, put your eye down, your hand down. All right, I'm going to get closer and make sure they reflex very good. Reflexes are good. Now I'm going to move this forward and watch how they cross very well. Okay, sorry about that. And cover one eye, the same eye I cover. Okay, and tell me when you see my fingers in. Don't look at my fingers. Tell me when you see them come in.
Okay. 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 Okay.
Very good. Okay, that's fine. And number 5 is the trigeminal. So I need you to clench your jaw for me. Very good. Okay, just relax. 6 is facial sensory nerves. So close your eyes again. I'm sorry. And tell me what you feel. Is it soft or hard?
Soft. Soft. That's hard. Soft.
Okay, this time when I touch your face, tell me where I'm touching your face and if it's soft or hard.
Cheek hard. Cheek soft. Forehead hard. Chin soft.
Very good. Okay, you can open your eyes. Number 7 is facial motion. So smile, frown, puff your cheeks, raise your eyebrows, and squint your eyes. Very good. Number 8 is hearing. So we're going to do the whisper test, and I'm going to whisper, close that, cover up that ear, and I'm going to whisper just one ear. And you repeat back to me what I whisper.
3, 5.
Very good. One thing we forgot to do a while ago, and we'll go ahead and take care of it now since we're doing hearing, is the Ryan and Weber test. So I'm going to put this on the top of your head. You tell me if you hear it bilaterally in both ears, okay?
Yes.
Okay, very good. Now, we're gonna measure air and bone conduction with this. So I'm gonna hold it behind your ear. Tell me when you stop hearing it. I'm gonna hold it in your ear. Tell me when you stop hearing it.
Okay. Okay.
All right, that is a normal finding that bone conduction is not as long as air conduction. Okay, so we got to number 7, number 8, hearing. Number 9 and 10 are your gag reflexes and your uvula motion. So stick out your tongue. And I think you're normal with that. Very good. Number 11, shrug your shoulders. Very good. Number 12, stick your tongue out. Very good. Okay, moving on. Oh, one more thing. Let's go ahead and do this. Close your eyes. I'm gonna put this in your hand. Tell me what you feel.
Paperclip.
Very good. Okay, so we're gonna finish inspecting the neck. We're feeling for lymph nodes, post-auricular, preauricular, tonsillar, submandibular, submental, posterior clavicular chain, anterior clavicular chain, and the supraclavicular. And none of them stand out to me at all. Let's go ahead, while we're here, and do your range of motion the best you can. So backwards and forwards and side to side. Okay, so my patient has had serious neck surgery. He's going to score about a 3 out of 5 on that. All right, now I'm going to go behind and check your thyroid. Okay, that's all fine. Let me get my stethoscope. We're going to listen to your carotids, and then I'm going to get you to lay down and we'll check your JVD. No, not yet. Hang on. So. Very good. Okay. Now lay on back. Okay. All right. So turn that way just a little bit. All right, so this is his right side. This is where it would show up if he had JVD, jugular vein distension, and it is not. Turn this way just a little bit, and it is not showing up on this side either. Good job. All right, sit on up. We're going to move on to the lungs at this point. So the first thing we were going to do, if he were in a gown, which normally your patient will be in a gown, we would be inspecting the skin for any sores, any lesions, any prior surgery, scarring, or anything that might be of concern. And while we're palpating, we might as well go ahead and do the tactile rheumatist. So when I say 99, you repeat after me, okay? 99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
Very good. And deep breath in and out. All right, expansion is good. I'm going to go ahead and percuss while we're here. Okay, all that percussed just fine. No anomalies or weird sounds. It was sensitive. We're going to listen with the stethoscope. Deep breath in. Wait, hold on. Let me turn it around one more time. There you go. Now. And again. And again. Again. Keep going. Good job. Okay. Now we're going to come around on the front side and do the same thing for the lungs. So we're going to inspect. If he had a gown on, we'd be inspecting more intensely. Looking at the skin, looking at scarring. Some of your patients may have had prior neck surgeries, as he has had, or they could have had a cabbage or some other kind of lung surgery, which would show up. So we're going to do the same thing. The tactile thermometer, 99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
Okay, and then we're going to percuss. Very good. And we're going to listen. Deep breaths in and out. All right. All lung fields on the back and the front, posteriorly and anteriorly, are clear. I didn't hear any abnormal lung sounds, so I do not expect a pleural effusion or any other kind of lung anomaly. So now we're going to listen to your heart, since we're right here. We're going to start with the pulmonic. Aortic. Herb's point. Tricuspid. Apical. Very good. And I did hear S1 and S2 in all fields. So we're going to turn this around and listen for murmurs and such as that. Same place. Pulmonic. Tricuspid. Very good. There were no abnormal sounds on either side of the valve of the stethoscope. Lung fields are clear, so we are going to move on to the abdomen. Let me get you to lay down. Okay, and just pull your shirt up a little bit for me. All right, first thing we're going to check is sensory in the abdomen. I'm just going to run this across, and yes, he has a normal reflex. So first of all, what we're doing is we're going to inspect again for any abnormal sores or bruising, scars that may tell you a little bit about their history that they forgot about or something. And then we're going to listen, all 4 quadrants. Okay. I hear vowel sounds in all 4 quadrants. So now we're going to percuss. And, oh, I forgot to listen. We're going to listen to, turn the bell around and listen for any abnormal sounds around the aorta. Okay, all that's clear. Now we're going to percuss. Okay, and we should be able to percuss the liver, so we're going to go up a little bit higher and almost outline it. Okay, and now we're going to palpate. We're looking for anything, any kind of response to pain as we do this, while we feel of anything that may be out of the ordinary. Sometimes your patient needs to just be examined before they go to the CAT scan. Okay, and then we're going to kidneys. Okay. All right. Pull your shirt down. Moving on, let me get you to sit on up. All right, so we've done your neck. Let's start with your shoulders. So we're going to test the strength of your shoulders. Try to push up on my hands. Okay, down. All right, very good. And we're going to inspect the shoulders as we do that, just to see if there's any bones out of place, nodules, anything of concern. Okay. Now, so range of motion. Can you put your arms behind you, in front of you? One arm across, one arm down, one arm over the head. Very good. Range of motion is good. We're going to inspect the arm, going from the shoulder down to the arm. This patient, as you well know, continuous glucose monitors are becoming more popular. He has one on his arm, so be careful when you start doing this that you don't run across this thing and knock it off. All right, so we're going to palpate. All the skin is intact. There are no bruising, no cuts, no scarring, nothing of concern. The elbow is normal, no bones out of place or anything. So we're going to, let's do, this patient has had a stroke on this side. So I should test his strength on this side. Actually, I should test his strength on both sides. So again, we're going to examine this arm the same way. Okay, now to test strength in your arms, I'm gonna pull and you pull at the same time. Very good. So that seems equal, even though he has a history of a stroke. He has completely recovered from it. Moving down the arm, we're going to the hand. The hand is not bruised. There are no bony places that are of concern. There are no cuts, bruises, abrasions. His capillary refill is 2 seconds. And let's check your range of, actually, first of all, let's check your grip, since you have had a stroke. Grip is even on both sides. That's a 5 out of 5. Okay, so let's check range of motion. So do your hands up, down, up again, side to side. Make a fist, down, up, side to side. Fan your fingers, and I'm gonna try to close them. Very good. So he scores a 5 out of 5. Arm strength, shoulder strength, arm strength, shoulder strength, elbows, and hands. So while we're here, we're going to go ahead and check reflexes. Now, we tried this earlier, and on this particular patient, the side that he had a stroke on has better reflexes, so that's what we're going to do. So we're going to check the brachial. Just relax your hand. Okay. No, that's the radial. I'm sorry, that's the radial. Bicep. Okay, and do your best. Hang it up like this and just relax it. Okay, that's great. I'm gonna go ahead and do his feet and legs. So this was the side that we had better results with. Okay, so here we go. This is the patellar. Okay, and this is posterior. This is Achilles. Very good. Okay, so we haven't done your leg strength, have we? So let's lay down. This is, we're measuring the strength range of motion of the lower torso. First of all, we're going to palpate the hip area. We're going hip down. So there's no anomaly, no bony protuberance or anything in his hip. If he were in a gown, we would inspect the skin a whole lot better than that. So moving down the leg, actually let's do the hip range of motion. So we're just going to do one leg. Raise one leg, whichever one you choose. Okay, put it down. Cross it over your other leg. Very good. Cross it and cross it. And they do it out like scissors. And pull it back. Very good. Now, at this point, we would start inspecting the skin and the bony area of the knee all the way down the leg. And I feel no areas of concern. So range of motion for the knee, raise your knee to your chin the best you can. Hold it up. Very good. Put it down. Okay? And moving on to the feet. The ankles, we're going to inspect the ankles to make sure there's no bruises. Again, nothing of any concern. He does have some scratches. I think those came from the yard this weekend. So, range of motion in your feet. Pull your feet back, pointing forward, side to side, round and round. Plant your toes forward, and let's do the Babinski while we're here. So the camera can see it one more time. And that is the side he had a stroke on. And we're going to check pulses at this time. So we're going to start up here. We've already checked the carotid. This is the brachial. Very good. No, this is the radial. Thank you. Brachial to the side. Yes. If he were in a gown, we would check his femoral, but he's not, so we're going to move on. So back behind the knee is the popliteal. And then the posterior tibial. And then the pedal. Okay. All right, so we've checked range of motion in the lower torso, upper torso. There's one more thing we need to do. Let's stand up. And this room is very cramped, so I'm gonna get behind you. There we go, like this. Yeah, there we go. All right, I might need to back up a little bit more because that wall. Okay, so feet together, arms out to the side. No, out to your side. Yeah, watch the wall. Out like this. Now close your eyes. This is the Romberg test, and there is no swaying. Okay, put your arms down. Now he's gonna have to walk toward the camera. So take about 4 or 5 steps forward. Turn around, and heel to toe back, and turn around, and tiptoe forward, and tiptoe back, or just walk back. Very good. You can have a seat. You've been a very good patient. Thank you so much for watching. I hope you enjoyed it. I hope you learned something. If you have any questions, be sure to call me. Thank you so much.